Welcome everyone to this overview of trauma-informed care in dentistry. My name's Dougie Marks. I am a lecturer in behavioural sciences at the University of Glasgow in the School of Medicine, Dentistry and Nursing. What I'm going to do for the next short while is to give you a little bit of an overview of a training package that we've put together along with Ness to provide an overview for dentists and people working in dental care in general about what trauma-informed care is and how that is relevant and how it's important to those who are working within dental care. Now, you might be thinking, trauma-informed care, we already do that. You might be thinking about physical trauma. What we are really focusing on is psychological trauma. So it's a little bit of a different area despite having a similar name. You'll be hearing lots of words about trauma-informed care and lots of policies and things around at the moment. There's quite a lot of movement within healthcare in general on this area. And because of that, it's important for dentists to become aware of it and to be aware of the different movements that are being made across Scotland and more widely as well. One of the reasons for becoming trauma-informed is that the Scottish Government have created a framework that basically says that everybody who's working within the public sector, or indeed working within Scotland in general, should be trauma-informed. The current Scottish guidelines came out in 2017, and this is a quote from them. "Trauma should be everyone's business, and that, as members of the Scottish workforce, everyone has a role to play in understanding and responding to people affected by trauma. That doesn't mean everyone needs to be a trauma expert, but instead that all workers, in the context of their own role and work remit, have a unique and essential trauma-informed role to play in responding to people who are affected by trauma." So from a Scottish Government perspective, they're seeing it's been quite important to have a situation where the workforce generally in Scotland is trauma-informed. Trauma-informed is the basic level of understanding, where the hope is that everybody should have an understanding of this and what this issue is. On top of that, there's another level which is called trauma-skilled. This is really the area that healthcare professionals in general should be working towards or should achieve. Being trauma-skilled means having the knowledge and skills to work with people who have been affected by trauma. And this is very important whenever you are somebody who is regularly coming into contact with individuals who may well be affected by trauma. And this is obviously very important whenever you're working with members of the public, and particularly whenever you're working within healthcare. So, as well as the fact that the Scottish Government has requirements around this, what are the other reasons to practice trauma-informed care? Why might this be important, and why might it be relevant to people working within dental care? Well, hopefully to make the point, I'd like to share a couple of case studies with you to show you the type of patients who might have issues around these kind of areas. And these are patients that you may well see regularly within your dental practice. This is Emily. She's a 13-year-old who requires orthodontic extractions. She's been a regular attender throughout her life, but she's never really needed any treatment until now. Now she comes in and she seems slightly anxious of needles, and extraction seems a little bit scary as well, but she thinks she'll be able to cope. This is Lindsay Ann, who's a 14-year-old requiring an examination. She's been referred to the public dental service by her GDP due to lack of cooperation. She attends with mum and brother and is willing to sit in the dental chair, but will not allow anyone to examine her. This is Linda, who's 12 years old. She's referred to the PDS for extractions of Roseland-Carious adult molars after being non-cooperative. She was very upset and refused treatment at the dentist, and she's referred for a general anaesthetic. Now, although these three cases are young people, they don't have to be. These might be adult cases who you're seeing in your practice. And you can see here that there's three maybe different levels of anxiety that these individuals are presenting with. With Emily in the first instance, a little bit of anxiety, but seems as if she's going to be able to go through with the treatment. With Lindsay Ann, a bit more anxiety and a bit more reluctant to maybe be examined and to be treated. And here we have Linda, who is very upset and has refused any treatment. And it's got to the point where a general anaesthetic is being advised for her. Now, these are three, in some senses, very different presentations, but they might all share a very similar underpinning history and an underlying background. You might think, why would their history matter? What difference does it make what psychological, what social history an individual has whenever they're coming to the dentist? You might think that if somebody's got anxiety about the dentist, the anxiety is to do with their fear of pain or their fear of injections, or maybe their fear of the sight of blood or something like that. Well, that might be the case with somebody who's anxious at the dentist. Very often, that's not the case. Very often, there's other psychological issues that have been important in the past that make them more likely to find situations in the dentist difficult. So let's look at some of those histories. Emily has been a victim of bullying at school. This has been an ongoing problem, but the day that she attends the appointment, she's actually had quite a bad experience with the bullies. Because of this experience, she's got problems trusting other people. She's constantly on high alert, especially when she meets people that are new to her or she doesn't know very well. And because of that, she doesn't like feeling out of control. And this can make her quite anxious when she's at the dentist or in lots of other situations as well. For Lindsay Ann, there's a long running history of domestic abuse within her family. She's witnessed her father hitting her mother and her sister, and she's very concerned about her mother's well-being. This little girl is worried. This little girl has issues with thinking about the relationships around her, and this can make her very anxious when she comes into the dentist or indeed any other stressful situation. For Linda, she has a previous history of general anaesthetic to deal with dental problems. For this procedure, more teeth were taken out than she had been told were going to be taken out. She remembers waking up from the general anaesthetic with a large amount of blood in her mouth and hearing other patients screaming around her. She remembers seeing her mum upset and crying before and after the operation. So for this patient, there's a lot of threat associated with going to the dentist. There's a lot of problems that are associated with it that are, yes, maybe partly to do with the dental procedure, but are quite broad in this context as well. So each of these young people have had psychological trauma in their past. That means that when they come to clinic, it can be quite a distressing experience for them. They can be very anxious, they can be on hyper alert, they can respond in different ways that are maybe problematic for them, sometimes maybe problematic within the clinic as well. And it's not necessarily anything to do with the actual dental procedure itself, but it's to do with their wider psychological experiences. Now, if somebody has had difficult experiences in the past, or indeed in the present, why is it that the dentist itself can be a place that triggers this? Well, for a lot of people, there are a lot of potentially fearful events that happen within a dental clinic. It can be quite a stressful place because a lot of people associate it with shame. A lot of people feel as if going to the dentist is a place where you will be judged, you will be pointed at. There's also potentially the threat of invasive procedures being done, things that are not normally carried out in everyday life. It doesn't have to be things like needles. It can even be things like people invading your personal body space. These kind of issues can be quite a problem for somebody who's anxious or somebody who's experienced psychological trauma in the past. And a dental clinic has all of these different stimuli going on at the same time. And we talk about triggers, which is some ways a bit of a controversial word, but it may be that the dental practitioner themselves has no awareness of what's going on in the clinic that might be reminding the person of previous trauma. And that reminding doesn't even have to be conscious necessarily. It may be something that they've experienced in the past that is a memory that is activated because of something that happens in the clinic. If somebody has been in situations before where they have felt very powerless, They might feel powerless again in the dental chair. Lying back in the chair itself is obviously quite a vulnerable position. There is invasion of personal body space, somebody putting things in your mouth. These can all be triggers that make somebody feel very, very powerless, even if it's not obvious to the dentist. Smell is quite an important trigger for memory. It can be that smell of a perfume or an aftershave is reminding somebody of somebody being very close to them in the past in a way that's been very uncomfortable. Some of the words and the language that dentists use as well can be quite problematic. Even things like songs on the radio that trigger memories can make somebody feel quite anxious. And again, it's not entirely obvious sometimes where people are feeling like this. Now, we all know that the dentist themselves and the dental nurse or hygienist or any other clinical staff, we know that they have an important role to play. So have other staff as well that are not clinicians. So often within a clinic, if a patient is going to get into an argument or a disagreement with somebody, the person that is going to be the administrative staff within the clinic. And sometimes that uncomfortableness a patient feels, that distress, that anger even, is to do with the fact that they've experienced psychological trauma in the past. And because of the nature of the dental clinic itself, they're quite hypervigilant as a result. And therefore, fight or flight kicks in and it can cause problems for staff that are not clinical staff. So this training is important for those staff. It's important that they have the opportunity to be able to learn and to be able to know what type of triggers might make life difficult for patients and how they can deal with that, how they can respond to it as well. Now, NES, NHS Education for Scotland, have done some work on this, and they've done a couple of training videos that are online. If you look for NES, Transforming Psychological Trauma, if you just Google that, you'll find these videos. I would recommend having a look at those videos before coming to the training. They're very, very useful. They give you a good overview of psychological trauma and its impact in clinical practice. It's not focused on dentistry. It's looking at public service in all forms, but it's a very good introduction. So I would start with that if you've got a spare 10 minutes. Our aim is to provide training for all staff, not just clinicians, as I've said, on trauma-informed care. It takes about half a day, so it's not too long a time commitment. If you think about how many patients you come into contact with every day who may have experienced some kind of psychological trauma and who this issue might be important for, it's hopefully you'll see half a day well spent. It will hopefully make a big difference. There is material included on self-care. We obviously don't ask anyone to disclose anything about their own private life, but we are aware that NHS staff are also human beings who may themselves have suffered psychological trauma. And the day itself includes material on how to deal with that. And we want to make sure that all clinicians themselves look after themselves as well, and other staff as well. So thank you for your attention. I hope to see you all at the half-a-day training course. And before that, if you could have a look at the Transforming Psychological Trauma video online in your own time, at your own pace, that would be great.